So friends, welcome back on our YouTube channel, Amazing Whiteboard. So today in this video, we are going to learn about tonsillitis. So let me understand from the definition what is tonsillitis. So definition of tonsillitis is infection or the inflammation of tonsil is called as tonsillitis. So let me understand what is tonsil. So here some figure of mouth. So here left side and right side, a round shape of organ is called tonsils. Mainly it is here. If you press here on the upper jaw, it's a tonsil. So infection or the inflammation of tonsil is called as tonsillitis. So let me understand the definition. So the definition is completed. So next one is etiology. Etiology means causes. Why it's happening? So first one is bacteria and then virus. So because of the bacteria and because of the virus, the chances of tonsillitis will be there. So bacteria is Streptococci bacteria and the virus is Influenza virus. It's a very most common bacteria and the virus, and because of them the chances of tonsillitis. Then the classification. Classification means types. Means types of tonsillitis is there. So first one is acute. Means if the tonsillitis will be there and it will be automatic or with the help of medicine will damage or we can solve within a week. It can be called acute tonsillitis. Then the chronic tonsillitis means it will be for long time, for a month or more than a month. It will called chronic tonsillitis. And the third one is recurrent tonsillitis. Means within a week or within 2 weeks tonsil will be there. Then tonsillitis will be means treatment will be happen. Means tonsil happen, then tonsil done, then tonsil again happen, then tonsil will be solved. So means recurrent means again and again tonsillitis will be happen and solved. So it will very complicated situation. So it is called recurrent tonsillitis. It's the third type of tonsillitis. Then here clinical manifestation means let me understand the sign and symptom of tonsillitis means why it's happening. So first one is sore throat. Means sign and symptoms means if anyone is suffering from tonsillitis. So first one is here sore throat means his throat is totally sore. Then difficulty in swelling. So if anyone having tonsillitis, so it will be very normal. It's the difficulty will be happen in swelling. Then fever. So because of the infection, the tonsillitis is happening. So to reduce the infection, the blood will or the body will produce WBC. So because of WBC, there is chances of fever. The body will rise its temperature to kill that outside bacteria, whatever the bacteria or virus. So automatic fever will be seen. Means it will observe the fever. Then swelling. So because of the tonsillitis, chances of swelling the cheek or the tonsils. Then white yellow patches. So here in the tonsil there will be chances of patches white and yellow patches. And enlarged lymph node. So here there is a lymph node also. So these chances to enlargement in lymph nodes. Then irritability. So because of this condition, there is chances of irritability in patient. Then here food poor feeding. So because of the tonsillitis, it's having difficulty in swelling. So the chances of poor feeding. So it was clinical manifestation of tonsillitis. Let me understand diagnosis means which kind of report we have to collect. We have to how we can diagnose, how we can identify that he is suffering from tonsillitis. So first one is physical throat examination. So physically we will just see, just say open your mouth, and he will open, and with the help of torch or with the help of light we can see that it's a tonsillitis, means abnormality in tonsils is there. Then throat swab test. So throat swab test means like a matchstick, and here like a earbud, cotton will be there, and because of with the help of this cotton we have to collect the swab, means how can you say the lard or saliva of the tonsil. So with the help of that saliva we have to find that it's a bacterial or virus there. So throat swab test, this type of test will be there. Then the blood test. So because of the help of the blood test we are going to find that it's a tonsillitis or not. Then the treatment. So diagnosis means it's completed. Now we have diagnosis, he is suffering from tonsillitis. So what is the treatment? How can we solve that problem? So treatment, there is three type of treatments. First one is home care. At the home, anyone is suffering from tonsillitis, so how we can solve it? Or then the medical treatment, which kind of medicine we have to take, and the surgery. The last option is surgery. First one is home care treatment. So first thing is warm salt water gargle. So in a glass of water, system water means warm, and the salt water, we have to put salt in the water and just drink the water, keep it in the mouth and gargle, means and then omit it. So it's a warm soap water gargle. Then adequate fluid. So we have to take adequate fluid to prevent our body from the dehydration. Then the rest. So because of the tonsillitis, it means already developed poor fitting, so we have to do rest also. Then the pain relief and PCM. So if there is chances of fever and anything, because of that you are feeling pain, so you have to just take PCM, paracetamol. Then the next treatment is medical treatment. So here antibiotic and antipyretic. Why the antibiotic? Because of the bacteria. The virus here, bacteria here. So to solve that problem we have to use antibiotics and the antipyretic, because the body temperature is already right. As here we have seen the clinical manifestation of fever is there. So you have to take antipyretic. Then the surgery. So the last treatment is surgery, and it's called tonsillectomy. Tonsillectomy. Tonsillectomy means removal of all your tonsil is present. So removal of tonsil is called tonsillectomy. Means with the help of surgery, remove the tonsil. So it was the treatment. Then we have to understand what is complication. Complication means if you don't treat anything, so there is chances of complication. Suppose there is a tonsillitis. So if the tonsillitis will not be treated, so what is the complication? The first one is peritonsillar abscess. Abscess means fluid accumulation in tonsils or anywhere. Abscess means fluid accumulation. So peritonsillar abscess means in the tonsil there is chances of fluid accumulation, means pus formation. Then ear infection. Suppose if you not treat the tonsil, there is chances of ear infection, because the ear canal and the ear it's connected, and because of the tonsillitis infection there is chances of ear infection. Then the pneumonia fever. So because of this bacteria and chances of pneumonia fever. Then breathing difficulty, and if you don't treat the tonsillitis, so it's chances of breathing difficulty. And the nursing management. So our main topic, or we are going to be a nurse one day, so our main topic should be nursing management. So first one is temperature. So we have to manage the temperature. We have to check the temperature, give the antibiotic as per the doctor order. So it's the first one is temperature management. Then the throat condition checking, means a nurse have to analyze or check throat condition, means which level of tonsil is there. Continuously she have to check it means recovering or no. Then the fluid and the soft diet. A nurse have to provide fluid or the soft diet to the patient. Then maintain oral hygiene. The nurse have to educate about the oral hygiene, maintain the oral hygiene of the patient and the medication as per the doctor order. So nurse have to provide medication. Then they educate the parents or the child about the tonsillitis, what is happening, what is the complication, how it can be treated well at the home, or what is the medical, surgical treatment, everything we have, means a nurse have to provide education to parents. Then observe complications. Nurse have to observe the complications of tonsillitis. And the last topic of today is prevention. So, what is the prevention of tonsillitis? It's very simple. First one is hygiene on nurse or the anyone have to maintain the hygiene properly, hand washing before or after eating. So here avoid close contact with the infected person. So if anyone is infected from tonsil or anything, TB, malaria or whatever, so just have to not to do close contact. Just protect yourself first. Then the proper nutrition and the immune support. So anytime we have to take proper nutrition, and whatever we are taking we have to just check it will be good for our healthy body or no. So we have to maintain proper balanced diet, proper nutrition and the immune support. Whatever we are going to eat, we have to be conscious about that thing. So what is this carcinoma or non-carcinoma, whatever. So today in this video we have learned the definition of tonsil, etiology, classification, clinical manifestation, diagnosis, treatment, complication, nursing management and the prevention. Hope you understand this video. So if you watch video from this at the last, so I just want to request you, please comment me which kind of video is this and which kind of improvement you want to see me. I will try to improve myself, and if you have any doubt you can comment me or you can watch the video again. So thank you for watching this video. Jai Hind.